You're listening to The Stressless Life with Dr. Yip, the podcast about conquering your fears and overcoming anxiety. Our question for the day is, what is a treatment for anxiety and how does it work? I'm your host, Noah Larissy. Let's say hello to Dr. Yip.
Hi, Noah.
Dr. Yip is a licensed psychologist who's board certified in behavioral and cognitive therapy and an expert in the treatment of anxiety and OCD. So if you go to a Western doctor with a strep infection, chances are they will give you antibiotics. If you go to a dentist with a cavity, they'll give you a filling. Yet if you go to a psychologist for anxiety, you could end up with a variety of different treatments. Dr. Yip, how do you know which one is right?
Well, I base my treatments and my approach to treatment on what does the evidence show. So, for anxiety disorders, the evidence-based treatment is cognitive behavior therapy. More specifically, for OCD fears, phobias, panic disorder, we're talking about exposure-type therapies.
Where do you find this evidence? Is this from your patients, or how do you find this evidence?
In the world of psychology and psychiatry, there are many different paradigms, many different approaches to treatment. Unfortunately, not all therapies have proven that they have worked. So, for example, cognitive behavior therapy is a treatment approach that has been in existence for many, many decades. And we've actually have over 4 decades of research proving that CBT, cognitive behavior therapy, works for anxiety disorders. It is the treatment that has worked the most, that has shown the most successful results.
Okay, so what exactly is CBT and how does it sort of differ from traditional therapy?
Well, CBT is very different from traditional therapy. Traditional therapy looks into your history in terms of your childhood, what happened during your childhood, how might those experiences contributed to your personality and your functioning level today. The whole goal of traditional therapy is to generate insight in the hopes that if you gain insight into why this happened and why that happened, then you will change. Then it will give you sufficient information to change your behavior so that it's more adaptive to whatever the current situation is. However, CBT isn't focused about your history. Cognitive behavior therapy is a very active type of therapy. You're not just let's just say the idea of lying on the couch and just talking and talking and talking while the therapist is hidden somewhere and possibly even falling asleep, that is not CBT. CBT is a very active approach where the goal is to help you identify those thinking patterns, so the cognitive part, the thinking patterns that are flawed, that have inaccuracies in them, where I actually call these mind traps, where you're trapped in this specific faulty way of thinking. And the goal of cognitive therapy is to teach you how to identify where those flaws are so that you can address it and shift your thinking pattern, and it reflects reality more accurately. Now, research has shown that a lot of therapies combined with behavior therapy, a lot of the cognitive therapy combined with behavior therapy is very successful. So what does behavior therapy mean? Well, behavior therapy is basically teaching you ways that you can engage with your environment that will be adaptive, that will be productive, so that you are living a healthy life. Not just thinking healthily, you're also living healthily.
So I'm sure some listeners here are thinking, I just want a therapist who's nice, who listens to what I have to say, who's sort of patient. What do you say about that?
Well, I would assume that to be expected of all therapists, right? Your therapist is nice. Your therapist listens to what you're saying. Your therapist has empathy for your experiences. Your therapist is compassionate. However, your therapist is also skilled at addressing the difficulties that you're experiencing. And that requires a therapist who, if you're suffering from anxiety disorders, that requires a therapist who is trained in cognitive behavior therapy, who is trained in doing exposure therapy if you're dealing with specific fears, because exposure therapy is the number one evidence-based treatment for fears and phobias and OCD. You have to think of it this way. CBT is literally training your brain. You're working out the muscles in your brain so that you can think differently, to allow you to engage with your environment in more healthy ways.
Okay, so you mentioned exposure therapy. Let's tell our audience specifically what that is.
Whenever you experience a fear, what is the natural reaction? What do you think is a natural reaction? Let's go back to that spider.
Fight or flight.
Fight or flight. Okay, so that is an automatic reaction. That is your body's reaction, right? However, what is a person's natural reaction when they see something they fear? Is it to avoid it, go away from it, retreat to safety, or is it to approach the potential danger?
Avoid.
Avoid. And when you avoid, what does that do for you?
Well, it gets you away from the spider.
Yes, it definitely gets you away from that harmful, poisonous garden spider.
So you're saying avoid gets you away, at least temporarily, from whatever your negative feelings you're experiencing.
It gets you away. Unfortunately, it never provides you with the opportunity to experience the trigger, the object, the fear, so that you realize it's not threatening. It's actually not harmful, right? So exposure therapy teaches you in stepwise ways in terms of how to confront that fear, so that you learn it's not that harmful. It actually isn't that threatening. Now, remember, most fears today are not realistic, are not rational, or they're so far off into the future that it doesn't make sense to be ruminating over them in this very moment. So when we're talking about exposing ourselves to fears and phobias, we're talking about those irrational fears and phobias.
So let's take a specific example here of how exposure therapy would deal with a fear. Let's say you had a fear of spiders or bugs or something like that. What would be an exposure to that particular phobia?
Let's say your fear is a tarantula, okay? So what we would start are other bugs, other insects that you might not be as afraid to. We might start by looking through pictures, going through YouTube and looking at videos of whatever that insect is. Eventually, we'll move up to harmless garden spiders, daddy long legs. We'll look at photos, and then we'll move to videos. And then eventually, we'll start looking at tarantulas and even more harmful, poisonous spiders, and looking at pictures of them, and then looking at videos of what they do, and maybe even go as far as looking at what they do with their prey. And then once you've habituated to that, so we'll talk about habituation in a little bit, we will then perhaps go and actually look at an insect in a container. So we might go to the Petco down the street from here, and we will look at what are those hopping insects?
Grasshoppers?
No, they're not. Yes, the grasshoppers. Though there's another one where they're chirping and they're making noise. It's skipping out of my head right now.
Crickets.
Crickets, yes. We've taken patients to Petco and just observe crickets. Sometimes we even have the people there take the crickets out and put them in your hand and feeling the cricket, not harming the cricket, of course. And eventually we'll work our way to harmless spiders. You might not be willing to hold a spider in your hand. You might start by holding it in a container and then eventually opening it up, putting the spider in your hand. And then eventually we might even go to looking at a tarantula that is in a container. Of course, we're not going to expose you to anything that will actually be harmful.
Okay, so I'm sure a lot of our listeners are saying, great, I know what to do now if I ever become afraid of spiders or crickets. But what if I'm generally just kind of worried about stuff? How is CBT going to help me?
Well, there are many different approaches in CBT to dealing with worries and dealing with anxiety. Exposure therapy is just a broad umbrella to talk about. In order to defeat a fear, you have to be able to approach it. You have to be able to confront it so that your comfort zone actually expands, right? Because when you're dealing with fears, what's actually happening is you're closing up your comfort zone because you're constantly hypervigilant on whatever that fear is. So exposure therapy is just one subset of cognitive behavioral therapy. For example, if someone who is constantly worried about finances, well, one of the things that we might do is specifically do a worry time. So what does that mean? That means for 15 minutes, what I'm going to ask you to do is write about worries. I want you to write about you worrying about your finances. And for the whole duration of the 15 minutes, your pen have to keep going. Even if that means you have to recycle an old worry again and again and again, your pen has to keep going for the whole duration of the 15 minutes before you stop. And what do you think happens at that point when we have patients doing the 15-minute worry time?
I'd imagine they would get kind of tired of doing it pretty quick, tired of doing their worries.
Yes, and the reality to that is there is only so much about finances that you can be worried about. The problem is that it's stuck in your mind. It's internal. And therefore, there's no beginning, there's no end. And part of doing a worry time is externalizing that internal worry. So rather than keeping it contained mentally, you're actually doing something with it so that it becomes tangible and concrete. And you'd be surprised at how quickly you get tired of that specific worry because there's really not much more than worrying about what might happen if your finances are limited and if you don't have sufficient finances to provide for yourself or your family and so forth and so on. Now, if I asked you to do that 5 times a day, doing a 15-minute worry time of your finances, do you think that you will be worrying about your finances throughout the day?
Hopefully not. Hopefully you'd be so tired of it by that point.
Yes, and that is the goal. The goal is to be containing the worry within a subset of time so that it is tangible, it is controlled, and you're not worrying periodically, randomly, spontaneously throughout the day.
Some listeners might be thinking, God, this sounds like a lot of work.
CBT is work.
Do I have to stay in therapy for like years?
No. That is the beautiful thing about CBT. It is short-term with long-term benefits. The goal that we have at the Renewed Freedom Center for our patients is that we are training our patients how to be their own therapists. They are learning these specific strategies, these specific tools, so that over time they learn, oh, well, this is what I'm experiencing. I remember applying this tool, so let me do that again. Because we don't want people to be dependent on us. We don't want to see you for years and years and years. We want you to become functional and effective with the strategies that you learn and being able to apply the tools that you learn to any circumstance that might arise in the future. So with CBT, you are learning specific tools. You're learning specific strategies to help you deal with anxiety over the long course of your life.
So that sounds good, so it doesn't take years and stuff. But, what if I'm really busy and this all sounds kind of difficult? So I was just wondering, isn't there just like a pill that you can take for anxiety, kind of make it go away? I've heard that they have these.
Okay, so, well, first of all, we're all busy. And yes, it's true, CBT is a lot of work. It's like going back to school. You're actually learning a new skill. And any skill worth having is going to require time. It's no different than learning a new language, learning a new instrument. Going to therapy means you are learning, you're acquiring the skill. And then in between sessions, it's your job to actually apply and practice the skills so that you build the skill set, you build the ability to actually utilize these strategies for whatever circumstance that might arise. Now, that also means that you'll be given assignments in between sessions to reinforce whatever skill, whatever tools that you've learned in session. Is there a pill to take? There are medications, antidepressants that may reduce the experience of anxiety. However, there is no pill available that will actually remove the fear. We don't have any pills for that. We don't have any pills that will actually remove the fear, remove the thoughts, remove the sensations. We have pills that will buffer the experience of anxiety so that you won't feel as anxious, though the fear itself is still present.
What if you are just thinking, yeah, I'm anxious, but this is just the way that I am. This is just the way that I was born. It's the way I am. And why should I change? This is just who I am.
If this is how you are and you feel you're living a functional, productive life, then I don't know why you would need to change, right? First of all, you have to remember that change requires motivation. Change requires effort. So if you're not motivated to change, then the likelihood of CBT working for you probably is very minimal because it will require effort. It will require that you believe you need to change. So if you don't believe you need to change, then you probably don't need to. In fact, most patients benefit when they see that they need to change, when they realize that they could live a better life, that they could live a more free life, a more functional life. And, earlier you asked, well, what if I'm busy? The truth is, if you're busy, yes, though, how much time are you spending worrying? How much time are you spending ruminating, being hypervigilant about the thoughts? And if you are spending a lot of time doing that, then why not shift that and use that time to work on beefing up your skills to deal with such anxiety and worries and thoughts?
So you've done a good job convincing me, but let's just say that all this talk about all this work and anxiety, it's actually making me
more anxious?
Kind of anxious. And in fact, maybe this is something that I'll deal with like in a year or two down the road.
I would say that it is a lot of work. You have to look at the long-term benefits. So it is planning for your life to live a more free life. So if you don't feel this is worth your time right now, then it probably isn't until you finally realize it would be beneficial. I would say, though, that's going to be true for most people, is that, you're not going to go and work out at the gym unless you really feel like you need to, or it's January 1st and it's your New Year resolution, right? Imagine CBT, you are doing mental push-ups, you're doing brain push-ups, and what you're doing is you are creating new neural pathways for your brain so that you can deal with life more effectively. You can manage and overcome challenges in healthier ways.
You've convinced me. So let's say I'm going to come in. How long does it take to work, and what kind of improvement can I expect?
How long does it take to work? That really depends on what you're suffering from. It depends on how complicated, how complex your presentation of symptoms are, and how severe those symptoms are. So if you're one of the people who are more proactive and are looking to gain tools and gain strategies early on, then the length of time is going to be pretty short. I would say, maybe 3 to 6 months on a weekly basis. However, again, most human beings are not that proactive. Most human beings will take time to realize that they need help. Usually when their functioning level is debilitated to a certain degree. In those cases, it will take longer. I would say, though, CBT, usually we don't have patients who are in active phase of treatment for more than a year and a half.
Are there some patients that CBT just doesn't work for?
I would say that there are some patients who do not like CBT rather than how you phrased it. Again, CBT requires work. And if you're willing to put in the work, you're willing to experience the discomfort short term so that you can experience relief long term, then CBT will work for you. Though there are people who don't like to experience any discomfort. And these are the people who would require, a pill to remove the anxiety. We've come to this generation, or actually this society, where no one can tolerate any discomfort. And it is debilitating because life is full of discomfort. And according to Darwin, it's those people who can adapt to their ever-changing environment that are likely to survive. So that means your ability to not just tolerate discomfort, adapt to that discomfort, and not be debilitated by it. So again, it's not that CBT doesn't work for some people. It's more some people can't tolerate CBT.
Thank you for listening to the Stressless Life podcast. You can join the discussion and find more information at www.dryip.com/thestresslesslife. Please write to us with questions and comments at thestresslesslife@dryip.com. Until next time, stay stressless.